Hello, everyone, and welcome to today's presentation. We're going to be covering everything that you need to know about cholesterol and how to properly assess for cardiovascular risk, things like heart attack and stroke. For those of you who don't know me, my name is Dr. Brianne Callanan. I'm a naturopathic and functional medicine doctor, and I help individuals get to the root cause of resistant weight loss, low energy, and metabolic concerns. What you're going to learn in this presentation is how to properly read a cholesterol panel. For so long, we have been told that normal cholesterol is really the key to heart health. But what even constitutes normal and what is actually being overlooked through traditional testing? There is a better way to test to truly predict individualized risk. We are going to talk about why a basic lipid panel or a basic cholesterol panel cannot predict risk in all patients and why this testing is outdated. We're also going to discuss what some better testing options would be to determine your actual risk for cardiovascular disease and adverse events like heart attack and stroke. We're going to be talking all about particle size testing. I'm going to teach you what that is and how to access this functional test to ensure that you are receiving the best care. Now, traditional basic blood lipid tests, they're still important. They provide information, but they're also missing a lot of information. So let's review what we typically see on a standard cholesterol panel. We see the total cholesterol. We see the LDL cholesterol, that quote unquote bad cholesterol. We also take a look at the HDL, or your good cholesterol, as well as triglycerides. Now, the number that you get on this testing is the weight of your cholesterol. So keep that in mind. When we're measuring this, it's the weight. But this does not tell us, is that weight of cholesterol made up of 5,000 particles or 500 particles? And this is really important because it makes a huge difference in terms of your risk of heart disease. And it also doesn't tell us about the buoyancy or the size of these particles. So this is really key. I'm going to show you some visualizations and slides so this becomes easier for you to understand. Now, cholesterol is villainized, right? We hear cholesterol and we think automatically bad. Cholesterol is produced by the liver, but it's also made by most cells in the body. And cholesterol is actually really important for us. It gives the structure and the fluidity of cell membranes. Cholesterol is important for building our hormones. Estrogen, testosterone, adrenal hormones. It helps to produce bile acids, which is really important for us to digest fats and absorb key nutrients. And it helps your metabolism work efficiently. For example, cholesterol is essential for your body to produce vitamin D. So when we hear cholesterol, it's not correct to automatically think this is something that's really terrible and we need to reduce it at all costs, because it does have important functions in the body. Now, when we look at what actually is cholesterol, what is LDL, or this bad cholesterol that we're so focused on? LDL needs to be considered in terms of volume, so how much you have, but we also need to understand how that cholesterol is being moved and transported throughout the body. And how the cholesterol is being moved and transported can vary based off of different particle sizes. You can have your cholesterol carried in really large, buoyant transporters, or you can have your cholesterol transmitted in small, dense particles. Now, stay tuned here, stay with me. I'm going to show you the visuals now to help you understand this. I think this analogy is really great, and it's helped me in explaining this concept to patients in my practice. Here, you can see the trucks. The trucks are carrying sand or dirt. The trucks represent the LDL particles. This is how they're being transported. Whereas the sand or the dirt, the yellow substance in these dump trucks, represents the sand. So the trucks are the particles, the LDL is the sand. Now, each truck can carry 1 ton of sand. So this is an example of one way the body could carry cholesterol around. And the amount of trucks that you have is really important because that is your particle size number. Now let's compare this to another example. You can carry the same weight of cholesterol in 3 larger trucks. We go back, the same weight of cholesterol or the same weight of dirt or sand is carried in 5 trucks. Now this makes a key difference because it determines your risk of cardiovascular disease. The amount of sand or the amount of cholesterol, the volume is just one aspect. It's really important how we look at how the cholesterol is transported around the body. A traditional cholesterol panel does not tell us this. It only tells us about the weight. So as we can see here, same volume, less trucks. Now, when we look at this example, same volume of sand, same volume of cholesterol, but now it's carried in 2, 4, 6, 8, 10 trucks. So these are 3 examples that all defer or confer different risk in terms of cardiovascular disease. What we want to know is the weight of cholesterol that you have being carried in a way that's detrimental, that can cause adverse events like a heart attack or stroke, or is it not? So these are 3 examples, all conveying different risk. This is really, really important because if we just look at the weight, we have no idea how it's being carried around the body. If you have high amounts of LDL, you've got a lot of sand, and you have high LDL particles, it's being carried around in a lot of trucks, that's high risk. A lot of sand carried around in a lot of trucks, high risk. Whereas if you have a little sand and few trucks, that is the lowest risk. Now, this is where it gets interesting. So if you have high particle size, high volume, high risk. Low particle size, low volume, low risk. That makes sense. But what if we see a patient who has high LDL, so a lot of volume, but low particle size? It's carried around in a few trucks. That's lower risk. Think of when you're driving on the highway. The more cars you have, the more risk there is for an accident. You can think of it the same way when it comes to cholesterol transport throughout the body. If you have low LDL, little sand, but you have high particles, a lot of trucks, that's actually a higher risk. So the patients that have been told that their LDL is great, it looks normal, they could still actually be at high risk if we're not also looking at the particle sizing. So we're missing patients. We're telling them that they're not at risk when they are. And the same thing is, we're telling patients who have a lot of cholesterol, but it's only carried around in a few trucks, we're telling them that they're at higher risk when they're actually not. And I think this is a really great opportunity to understand which patients would actually benefit from a treatment versus others who may not. This is my favorite slide. I really think that this summarizes everything. The same weight, so the scale is balanced. They have the same weight of cholesterol. If it's carried around in a lot of small particles, that is higher risk. Whereas if it's carried around in larger particles, less risk. Another analogy that I use with individuals in my practice is, say you're at a pool party and you get hit with a large beach ball. You're not going to care. It's not going to cause very much damage. That's essentially what these large buoyant particles are doing. If they hit the artery wall, not a big deal. It's not hurting you. It's just a beach ball. But if you're at that pool party and you get hit with a golf ball, that's going to create some pain and inflammation for you. Same volume, different risk. Now, let's go through some cases. Patient, pre-existing heart disease. We've been told that we want the LDL low. The LDL count or the volume was 82. So it looks pretty good. But the particle size is actually really high, 1,952. The goal for a patient with pre-existing heart disease is actually less than 1,000. So this individual is far from their goal, right? So they've probably went into their primary care, they had their basic lipid panel done. Yep, everything checks the box, you're good. Where they're actually at increased risk of heart attack and stroke based off of this particle size count, and we need to do something to change the particle size. And we're going to talk about how you can change those particle sizes in a second. This is a 50-year-old female patient, no history of heart disease. So we think, oh, no family history, no personal history, no risk. We did the LDL-C, and we found that her LDL was at 154, so it's on the higher end. But her LDL-P, the particle size, is 1,106. That's fantastic for somebody without pre-existing heart disease. If we only looked at the total volume of the cholesterol, we wouldn't accurately be able to assess the actual risk. We may be informing patients that they're at risk when they're otherwise not. This leads to unnecessary treatments. And on the other hand, we may be telling patients with normal cholesterol that they're fine, but if their particle size is high, they're actually at a far greater risk than we've otherwise conveyed to them. Now, what can you do to change the particle size? That's what the major question is going to be. If you have those small, buoyant, dense particle sizing, how do you shift that over to the large, buoyant beach balls? What we know is that we can shift the particle size by following a lower carb, moderate fat, adequate protein nutrition plan. And this is exactly what we do in the Metabolic Reset program. There are some individuals that have a problem processing saturated fats. That is involved with the FTO gene variant. So in my practice, what I do is I'm very cautious with saturated fats. I'm not saying you can't have them, but for the vast majority of my patients with LDL cholesterol, we're not eliminating them, but we're being mindful of them. We can decrease the LDL particle size in about 70% of individuals. So I think this is a really great opportunity. If you are doing a lower carb nutrition plan, this doesn't mean that you have to take out all the carbs, doesn't mean that you can never eat fruits. It's a lower carb nutrition plan where we're focusing on whole foods, fruits and vegetables, proteins, healthy fats. What we know from that is we can actually change the particle sizing, which is really amazing. Medications that lower cholesterol, they simply work on the volume. So we can see statin medications are really great at lowering LDL cholesterol, but they do not change how they're transmitted or the particle size throughout the body. So it's really important that when we're repeating the testing, that we're looking at how is the particle size changing. The most common underlying factor that I see for patients with a disadvantaged particle size panel is that they have an underlying condition called insulin resistance. If you have insulin resistance, prediabetes, issues with your blood sugar, if we correct that, often we can see a favorable change in the particle size as well. I'm going to go through, yes, the nutrition of the Metabolic Reset program. We're prioritizing protein. We're utilizing low glycemic fruits, so fruits that are high in fiber. We're focusing on healthy fats. We're doing at least half your plate of vegetables, cruciferous vegetables, lots of fiber. This is really important. As you can see here, there's no packaged foods, there's no shakes, there's no, it's healthy whole food nutrition. We teach you how to pair your macronutrients together. We teach you what your nutrition plan should look like. We guide you through it, and we can repeat blood work after to see the progress. Here's some examples of meals. I always get asked, what does your meals look like? I am not a chef by any means. I have very, very simple meals. So there's probably much better pictures when it comes to individuals who've gone through this program that are better at cooking than I am. But this is just some examples to give you an idea. The top right is actually takeout. I was at a conference. I got a kale salad. I threw a whole bunch of meat on top of it. You've got, if you're at a restaurant, you can do a grilled chicken breast and a salad. You can also get much more fancy with this, but I like to personally eat simply. So here's a case study. Jim weighed 202 pounds before the Metabolic Reset program. He was suffering with fatigue, mood changes, brain fog, prediabetes, and high cholesterol. So as you can see there, the total cholesterol is high, the LDL-C was high, and his triglycerides were starting to come up. The other thing that I noticed, and this is something that the Metabolic Reset program works really well on, is the hemoglobin A1C, or the blood sugar. He's sitting at a 5.8. So he's getting into that prediabetes category. This is something that we really want to work on, because remember, you can change your particle size, or 70% of individuals are capable of changing their particle size through proper nutrition and supplementation. We also saw markers of inflammation being elevated for him here, and insulin resistance. After the Metabolic Reset program, Jim lost 26 pounds. He reached his final goal weight. He's reversed his prediabetes. His high cholesterol has resolved. And with the recommendation and support of his prescribing provider, he was able to come off his statin medication. So he was really, really happy. Underlying issue, again, I have to say this over and over again. Insulin resistance is often the underlying issue that's driving the cholesterol. Not in all cases, but in a lot of cases. What we classically see in insulin-resistant patients is lower good cholesterol, lower HDL. We see higher triglycerides, and we see more of those dense particle sizes, those golf balls that are going to hit you at the pool party that you're not going to enjoy too much. Really, you want to focus on simple whole foods nutrition, sugars, processed foods, alcohol. That's all going to drive those small, dense particle size testing. So it doesn't necessarily mean if your cholesterol panel is normal that you can go ahead and consume processed foods and sugars and alcohol, because you may still have that elevated particle count number. If you've had a cholesterol panel done, maybe you haven't done the particle size piece of it yet, but you have your basic cholesterol panel, this is a really great resource. This is from the bloodcode.com. This is the triglyceride to HDL ratio. What you can do is take your triglyceride numbers, divide it by your good cholesterol or HDL, and that will give you a number. And that number can tell you, are we suspecting some insulin resistance being present? So if you have a ratio that's, I like to see it less than 1, but if it's, greater than 1, greater than 2, insulin resistance is definitely something that you want to investigate and get under control. The key with medications is certain people will require medication support. Again, medications will lower the volume, the LDL-C, but it does not change the particle size, and that's well documented in the literature. It's the nutrition and correcting the insulin resistance that's going to give you the best opportunity to change that particle size. What I feel is that if we did comprehensive testing, that we could otherwise prevent patients from being treated unnecessarily. I do feel that based off of the way that we are testing, how are we properly able to determine which patients are at actual risk and which patients would actually require a medication? With any medication, there are potential side effects, and it's weighing the two. Side effects of statin medications is it can make the insulin resistance worse, it can cause fatigue, it can cause muscle pain. Some patients absolutely do need to lower their LDL and will benefit from a statin medication. But I think we can more accurately determine who those patients are with more comprehensive testing. We do need both approaches. We need nutrition, and there are times that we need medication, but the personalized approach is key. Again, you need to understand the weight of your cholesterol and how it's being transported around the body. In terms of supplements, some of my favorite that can help to reduce triglycerides, reduce LDL, change the particle size are things like fish oils, EPA and DHEA. Berberine is another favorite one of mine, and I really like berberine because it also works on the insulin resistance piece. I'm also a really big fan of fiber. I think propylene in fiber is absolutely wonderful. And there's some studies on curcumin, which is a natural anti-inflammatory, the active component of turmeric. Here are some berberine options. Berberine is one of my favorite natural health products for managing the insulin resistance and resistant weight loss. It can also help with cholesterol. You have at the very first option is berberine HCl. This has the most research on it. It has been shown in head-to-head studies as comparative to metformin, the pharmaceutical medication we use for type 2 diabetes. Berberine HCl has the most research on it. There now exists a new form of berberine in the center called dihydroberberine. Dihydroberberine is new, so we don't have as much studies specifically on it. Dihydroberberine is 5 times better absorbed, so you can take significantly less of it to get the same results. Because it is better absorbed, it's usually better tolerated on the GI system. It causes less concerns with gas, bloating, diarrhea. Now, berberine does have some interactions with medications. It may not be safe for everybody, so you want to speak to your doctor prior to starting a new supplement. The third one on the end here is a combination of berberine as well as in situ and chromium. In situ is the only natural health product that contains an enzyme that can reduce the glycemic index spike of your meal by 48.3% at the first use. So my recommendation for most individuals struggling with insulin resistance metabolic concerns is to go with the berberine HCl because this is the most research on it. If you don't like taking a lot of capsules or you're not tolerating that, you could try the dihydroberberine. Now, if you're having a high carbohydrate meal, higher than you otherwise would, that's where I would use the carb block. If you're going on vacation, if you are, eating foods that are higher in carbohydrates, that's not the core base of your nutrition plan, the carb block can be really helpful there. Propylman fiber, I mentioned before. This is a wonderful fiber supplement that has been shown to help lower cholesterol levels. Whereas a lot of the other fibers like glucomannan fiber, when you look at the bottle, it will say help to maintain cholesterol in an already healthy range. So essentially it's not doing anything. Propylman fiber can also be really fantastic for blood sugar control, as well as insulin resistance, and can help with satiety and weight loss. Omega-3 fish oils are also wonderful. When you're looking for an omega-3, most of the studies on cardiovascular health are looking at a 2-to-1 ratio of EPA to DHA. You also want to make sure that you are getting a fish oil that's in its triglyceride form. This is the natural form that you would get if you were consuming fish. Some fish oil companies are using ethyl ester fish oils. I wouldn't recommend this. They're not as well absorbed and the studies aren't as great on it. The only benefit to an ethyl ester fish oil is the dose looks very nice on the label. It looks like you're getting a high dose, but it's not a fantastic quality. The med packs are something that I've created as an all-encompassing product that's easy to take, the little blister packs that's designed to address insulin resistance, the underlying issue in metabolic disease in a lot of cases. Now, this is very easy, convenient to take. You take the morning pack before your first meal. If you fast, you take it before lunch. PM pack before your second meal, and then your bedtime pack contains your magnesium and probiotic. This is all in one. It literally has everything from your fiber to your berberine, your chromium, your in situ, your ALA, and B vitamins to help with your Krebs cycle and energy. It has your magnesium and your tummy tone probiotic at bedtime. This is something that I take each and every day. I know personally when I've run my genetics, I'm at a high risk of both type 2 diabetes and obesity. So this is what I personally do to mitigate that risk, because your genes are not your destiny. Genetics increase your risk or predisposes you to things, but it's through your diet and lifestyle that dictates whether those genes are turned off or turned off. So I know that was a rapid fire presentation. I hope that was helpful for you. This is how you would go and access proper particle size testing done. You can go to Quest Diagnostics. They have a lab called the Cardio IQ. LabCorp sells an option. It's the NMR particle size testing. This runs you roughly anywhere from $75 to $100 to get this done. So I wouldn't say it's a super high cost test to do. Yes, it's more than a lipid panel, but this gives you the actual information that you need, right? You want to understand, are you actually at risk of an adverse health outcome? And I don't think that we can truly assess that risk for everybody when we only look at the LDL-C or the weight of the cholesterol. I really do think that particle size testing is quite important, and I don't know why we don't do it more often. So I hope that was helpful for you. You can access this blood work through the link there. You can go and do it yourself. Essentially what happens is you print the requisition, you go into a LabCorp. Also speak to your family doctor. Don't try anything new. This is for educational purposes only. This does not constitute a doctor-patient relationship. And my goal is to provide you with the education that you need to make informed health choices. So I hope that was helpful, and we'll talk to you soon.